Hey guys, Dr. Marcos Reyes here. I've been wanting to narrate this video for a long time. I actually posted this video on YouTube probably a couple of years ago. Life gets too busy and never got around to it. So this is a young 6-year-old gentleman who is behind his older cousin who was fishing with the lure. You can see they've already cut off the lure component. It's like a spinning lure, and the treble hook is stuck in the cornea. Got a bunch of crap, weeds and debris on the hook. I imagine he'd been fishing with it for a while and then got caught on there. He just never took it off. So he was standing behind his cousin, this little 6-year-old, and his cousin went back with the rod. It landed on the kid's cheek, and then the cousin cast, and it set the hook into the cornea. And he came to me, I think, probably 4 to 6 hours after the event. I think we're looking at maybe 10 o'clock at night, 11 o'clock at night, when I first saw him in the OR, or excuse me, the ER. So then we took him to the OR. So this is probably looking at around 11 o'clock midnight. So you can see I cleaned all the crap off there, and I'm holding the one end of the hook with hemostats. Now I put that orange stuff on there called betadine. It's 5% betadine solution. We typically use it for ocular surgery to cleanse the surface. I'd never used it on an open globe per se with a hook still in the eye, so there was some concern about it kind of penetrating inside the eye. But given all the risk of infection from bacteria and fungus and everything that was on that hook, I thought it was worth the chance there. And so now I'm going to try to cut this hook. We tried wire cutters that you see here. There were some ENT wire cutters, and then we pulled out these 2-foot pin cutters, orthopedic pin cutters from the orthopedic set. So I'm holding the little end here. I'm trying to get around the right kind of direction to cut this hook off. And my resident's up at the top with um, the top of the handles, getting ready to hold it together. And I mean, this thing is humongous, and we were hoping it would cut. We weren't sure, and boom, yes, we got it. So finally, the bulk of this hook, treble hook, is out of there. We just have one little hook still stuck in there, and I don't know where this hook is. I think the hook has entered the iris and hit the lens, perhaps even hit the vitreous cavity. There's a kind of different chambers to the eye. So I'm not exactly sure because all the bleeding and the fibrin and the clotting that's happened already. So now I'm putting antibiotic solution on the eye, moxifloxacin. This is commonly used um, for antibacterial prophylaxis during cataract surgery. So I'm going to go ahead and make some openings in the anterior chamber of the eye with this side port blade. The chamber is, of course, very shallow. The eye is a little bit soft, so you have to be super careful using this cannula with air, because I'm not sure what structures have been damaged or not. I'm just trying to get an idea. Things look okay, so now we're going to displace the air with a jelly-like substance called viscoelastic that we use to maintain space within the eye. There we go, so that creates some space. I still don't have a good idea of where this hook is. It's kind of difficult to see where we're at. So I thought about kind of turning the hook and kind of piercing the other side of the eye with the hook, with the sharp part, and kind of pulling it out from there, kind of continuing the path of the hook. But I decided to try to reverse it. And anyone who's been fishing with barbed hooks knows how difficult this is. So I'm pulling it out. You can kind of see the barb right there. The tip of the hook is at the edge between the clear part and the white part there. The barb showed there for a second. I'm trying to kind of jimmy this thing out. And it's hard to remove things with a barb. It was actually quite painful. I didn't show all my attempts. So I changed the video, and I changed my positioning with the hemostat in my hands. And so now I'm trying to push away from the barb and try to slide it out of that corneal wound there. And hallelujah, I can see it coming out. mean, the other goal, just besides getting this hook out, is to not damage any additional structures that are in the eye in the attempt of getting this out. So I was kind of concerned about that. And so there was some debris in the wound. And so I kind of pulled that out and trying to see what extent this, how big this wound is. And I have a curette here, and I'm all these instruments that we never use for intraocular surgery we're pulling out and trying to use to clean this wound up. And I use that curette to kind of scrape as much debris out of that wound as I could. Of course, here's more antibiotics. So now we're going to go ahead and use some 10-0 nylon sutures to close this corneal defect. And this is sped up. I believe I had my resident throw a couple, I can't remember honestly, and then we slowly got this done. And I'm showing how we threw one stitch, or one suture that we call it, but then I'll kind of just skip forward to after we've placed all 4 sutures. Sometimes wounds in the cornea can be a little bit difficult to close to keep watertight. You'd think it'd be easy, but it's not. So thankfully this wound was fairly straight, a bit jagged, but fairly straight, and only took 4 stitches to close it. Did not require any glue or anything like that, so that's quite nice. You can see that the cornea is now hazy, and we really can't see what's happening inside the eye. So I'm still concerned about what structures have or have not been damaged inside the eye, so I'm going to go ahead and kind of readjust some sutures, and then next we're going to go ahead and scrape the corneal surface. When the cornea gets kind of cloudy like this, it's usually the top layer of skin called the epithelium that's the main issue. So if you scrape this off, and sometimes retinal surgeons or other surgeons will do this to maintain or obtain a better view inside the eye. And this epithelium will grow back, thank goodness, within 24 to 48 hours. So you can see a very more clear view. The pupil is also beginning to be dilated because we put some dilating eye drops on the surface of the eye. It usually takes about 15 minutes, and of course I didn't show that. We spent some time just waiting. And now we're going to use some iris hooks. I'm taking care to not damage the lens. We all humans, all creatures that I know of, and maybe there's some that don't, all creatures have a lens inside of their eye, and this lens kind of autofocuses for us up until age about mid-40s. So I don't know if this lens has been damaged. If this lens has been damaged, then I need to take the lens out. And so I'm actually going in with instruments that we use to clean out vitreous, because I think maybe there's some vitreous there. I mean, vitreous is generally behind the lens. I just wasn't sure how far this hook had penetrated. So I'm not really doing anything. I'm kind of sweeping around to see if there's any vitreous strands, anything from the vitreous chamber, but there's not. And the lens, I'm kind of tilting the eye, the lens looks intact. I mean, surprisingly, I'm not sure how that hook was either right in front of the iris or between the iris and the lens or buried in the iris. And I'm going to show you guys a diagram because, I mean, the lens of the eye is right up against the iris itself. So I am extremely, extremely surprised that this lens was not damaged. I kind of put an arrow in there in the shape with a little curve in the shape of a hook. You can see how close it is. How did that happen? I have no idea. He just got lucky. That would have been a whole different ball game. So here we skip forward. I put 2 additional stitches in the wounds that we made, or some of the wounds that we made that I thought were possibility of leaking. The lens is intact. He's got some stitches there, and this kid is super, super lucky. It could have been a whole lot worse. So we put a contact lens afterwards, after we're all done, and we're checking to make sure everything's watertight. So we put a contact lens in afterwards, saw him the next day. Everything was healing, no infection, thank goodness. We continued to watch him over the next few months, and he never developed any infection, which I consider to be absolutely amazing, given how much crap was on that hook when we first got started. He also achieved 20/40 vision after all the stitches were removed and the healing complete. I consider this to be a great success. This certainly wasn't the outcome that I expected when I first saw the child in the emergency room that night, but I'm grateful for it. Thank you all for watching. Please hit the subscribe button below. This helps me out, and you can stay updated with all of our interesting cases in the operating room. Thanks again.